Hi, Dr. Evangelos Milonas at Kinetic Health. Now we'll be demonstrating some self-myofascial release of the hip flexors. So we've got Mickey once again, and what we'll be using is a soft foam roller. You wouldn't want to use the darker, harder foam roller or the travel roller for this particular exercise because they're a little too hard, and this area in through here is quite sensitive. There's a lot of neurological and vascular structures in there. So you want to take it easy, but you want to get an effective release as well. So we're going to have Mickey drop into position here. So she's positioning that foam roller just right at the front of the hip. And you can find a position that's comfortable so that you can maintain your balance. Great. And I'll have you kind of rock back and forth, starting to roll. Nice. And as you do this, you want to work the area out for, about a minute. When you come across a section of the muscle or the hip flexor that's tender, you're feeling a restriction, you probably want to focus in there for a bit and rock back and forth, work out that point for about 15 to 20 seconds. How does that feel?
Good.
Now, it's a great exercise for releasing the hip flexor. Another alternative to the foam roller would be the ball. So we've got a nice rubber ball here. We're going to give this to Mickey, and we're going to have you get in the same position as you were before. Yeah, perfect. Now the advantage to the ball is, because of its shape and size, you can work different areas of the hip flexor that you might not be able to get to with the foam roller. And it's also a whole different sensation. It allows you a lot more options, and I'll explain. So as you can see Mickey here, she's got the left leg out, and she's kind of focusing on a motion back and forth, but also in a rotation. And she's working different angles, different areas of the hip flexor. Now, if she wanted to go a little bit deeper into the inguinal region, we'd have her bring the right leg out. Exactly. So she's opening up the space now, and the ball's sinking in a bit, and she's working that area a little bit further towards the inside. So you definitely want to work the area, for about a minute. If you come across a point that's tender, restricted, you want to focus in for a good 20 seconds. And make sure you're not pushing too hard. Stay within your comfort levels because this is quite a sensitive area and you don't want to compress too much. You want to focus on releasing any restrictions. How does that feel?
Good.
Yeah. Do you find that it has a lot more range of motion?
A little bit less range of motion with the right leg out, but more range of motion with my left leg out.
Okay, sure. Try it again with the left leg. Yeah, as you can see, so with that left leg straight, she can move up and down, side to side. And with the other position, we're just getting in a little deeper at a different angle. It's a great way to do some self-myofascial release of the hip flexors. Good job.